primary controlling factor for density is MA. So if I was to ask you this, your image is too light. I want you to pick one of the three technical factors to increase your density. MA, time, and KDP. Your answer will always be MA, because MA is the primary controlling factor for density. And I'm just going to leave it at that right now. After I explain time to you, then you'll understand why. And time is the next one that we'll get to. So for right now, we're just going to take for granted that MA is the primary controlling factor for density. And it has a direct relationship. Direct means that if I go up in MA, my density goes up. And proportional means that if I double my MA, I will double my density. So it's direct and proportional. So if I go from 100 MA to 200 MA, my film will be twice as dark. Okay, any questions on that? Let's move on to time. Time, as you've seen, is abbreviated as a lowercase s. So what does time do? You have to set it as one of the three factors that you have to set during your exposure. So what exactly does it do? Jeff?
Multiplies MA.
Well, that's how we would use it, but what function does it serve?
The exposure window.
Hmm?
It's exposure window.
Exposure window, yeah.
Or
Or is it
length.
something else over here?
Also, it determines the time that the game is actually being shot.
That's exactly it. So time determines how long the primary beam is energized. Time determines how long the primary beam is energized. There's got to be some length of time that the patient is exposed to that X-ray beam. And the time station is the one that dictates it. So we know that MA is not as accurate as we would like it to be. MA requires constant calibration by the X-ray machine to make sure that if you set 100 MA, then you're going to get 100 MA. There are some devices in there that help ensure that we get 100 MA. Okay, but what about the timer? How accurate do you think the time?
Pretty accurate.
Time, as it turns out, is the most accurate one. We are very good at making timers. If there's one thing that we can make, it is a timer, by golly. Okay, the time station is the most accurate part of the X-ray machine. In Imaging 2 is kind of a quality assurance test class. You learn how to do QA tests on the X-ray machines and on everything, really. And you guys will test the timer accuracy in all of our machines, and they're perfect, all of them. I'll tell you right now, you're wasting your time doing that because it's perfect. Okay? But we'll do experiments to prove or disprove that. But the timer is the most accurate part. So since it's the most accurate part, why don't we have it affect density? Why is that not the primary controlling factor for density? You want to limit the what?
Radiation that not be controlling factor, because you would have to up your time.
And what would that potentially cause?
Mutation.
Mutations.
Because it's blurring
Motion, right,
motion or
motion. So we don't want to adjust you generally want to keep your time as low as you possibly can to help remove motion from your image. The number one worst thing, barring anything else, the worst thing that you can have on your image is motion. It's the worst thing. There's nothing worse than that. Okay? What dictates motion? The length of your exposure. If you have a very long exposure, well, you're increasing the likelihood of having motion on your film. Even if you're doing an abdomen where the patient's lying on the table, if you have a very long exposure, peristalsis, the normal peristalsis of the bowel, might show up and cause motion on your film. Doing a chest x-ray, very long exposure, oddly enough, the beating of the patient's heart, even though they're holding their breath, that will put motion on your film. Okay, so you want to keep your time station as low as you possibly can. So therefore, if you have an issue with density on your film, which factor do you want to use to adjust your density?
MA.
MA. Leave the time as low as you can. Go up in your MA. Go up in your MA because you're not going to impact motion. Going up in your MA is the safest thing to do.
Just a quick question. A lot of the newer machines don't even let you set the time.
Correct.
So what kind of time factor does it use?
Okay, it depends on the machine, but basically, X-ray machines that don't allow you to set the MA and time station, it is programmed in there to set the highest MA, which could be 1,000, and the lowest possible time that you can use. Okay, that's usually how they're set. Which brings me to another question. Okay, what if I asked you this question? Which of the following is the primary controlling factor for density? KVP or mass? Mass is MA times time, right? It's mass. Okay? If you see mass as the only logical choice, even though it's got time attached to it, you have to pick it because it's got the MA in there. If you don't have MA as a separate individual choice, and I'm not talking about my test, I'm talking about the registry and I'm talking about review books, you always have to pick the one that's got MA. That's the primary controlling factor for density. And if the MA is attached to time, like with mass, and there's not a separate MA choice, you gotta pick mass. You gotta pick mass. And it's because some machines don't allow you to set MA and time. All right? Time also has a direct and proportional impact on density. If I go up in my time, my film will get darker. My image will get darker. If I double my time, my image will have twice the density. So it acts the same way as MA. It acts the same way as MA. MA and time have a direct and proportional relationship on density. And we're going to do one more little small line up here. This would be a logical place to stop in our notes, and we'll take our break. Any questions on that? Everybody has that? Okay, let's talk about mass now. And mass, we know, is nothing more than a combination of MA times time. And it gives us our mass. Since MA has a direct and proportional relationship and time has a direct and proportional relationship, then of course mass, it's like one of those logic things, isn't it? Then mass would have a direct and proportional relationship on density. Okay, so let's come back in about 15 minutes or so. And hey, you know what? I think that we might have a free lunch today, so let's go outside and check.